Here we find out why women want to make changes to their appearance. Why do women go to the extent of wanting to have non-surgical cosmetics such as Botox and lip fillers? We have been invited to Lindsay's home where she is having a non-surgical cosmetic gathering called a Botox party. This is where women come round to the home to have Botox and lip filler treatments, which are done by Amanda Baker, who is an aesthetic nurse.
My name's Amanda Baker. I'm a registered general nurse, an independent nurse prescriber. I've been nursing for 34 years, a background in the operating theatre, particularly trauma and emergency. And I changed my career about 8 years ago to work in aesthetic medicine, and I've been working in a private clinic for 8 years doing aesthetic treatments such as botulinum toxin injections and dermal filler injections.
Botox comes as a powder in a vial, and it works out at 1 vial per client. So that's the Botox, which has to be reconstituted.
I like a natural look, a rejuvenated look, and that's my philosophy when I treat, so that when you look at a face, you don't know particularly if that person's had any treatment.
And the syringes that we're supplied with have a marking 0.63, yeah? So that's where the saline will go, and then it will get reconstituted into Botox.
We're just going to do the glabella, aren't we, darling, here?
Yeah.
That's all you want, isn't it? Many of my patients are similar to the ladies that have come tonight. They're very much the same. There are a range of age groups, diverse backgrounds, professional women or women who are at home with their children. Most women want to look and feel refreshed, look less tired, look more youthful. Not particularly look treated, but to look well, so that they have a sense of well-being and a look of well-being about them.
Although this procedure looks painful, women still go through with having them.
I would say these days, you're probably, I'd say at least 70 to 80% of women between the ages of 30 to 55 are probably having Botox now. It's high. When I first started doing this, it was probably about 10 or 20%. It has rocketed in the last 10 years, definitely. People are, it's very, very popular, and a lot of the time nobody knows what people are doing, but it is very, very, very popular, and I would say, yes, at least about 70% at least.
A total change in career, and it was a change that I needed to make after 27 years working in the operating theatre. It was time to look at a new way of working, and I was very interested in aesthetic medicine, which has been shown to improve people's confidence in the way they look and feel. The corners of your mouth up a little bit as well. Can you see where your lip is sitting up a bit more? And then we'll just do a little bit more gently around here, but it's just brought things up a little bit. A lot of research now shows that botulinum toxin injections can help lift mild depression. Botulinum toxin, otherwise known as Botox, is a way of treating scars in medicine that's treated for lots of different conditions, so it's a very interesting drug. I like to work with women, and I work with some men, but mainly women, and they improves their confidence and the way they feel about themselves and the way they present themselves to the world. So I particularly enjoy making those connections and building those relationships with women.
Thanks, Amanda.
My pleasure.
I'll be coming in
so
now,
when you
yeah.
smile, see how nice that, yeah. And then we just gently work a little bit more until we just slowly change things a little bit more. And breath in.
They're really good, them needles, Amanda.
I cannot feel it.
When I first had it done, yeah, I thought the injections were really going to be painful, but I was made to feel really, really comfortable. I didn't like the feeling at the start where there wasn't a lot of movement, but you get used to it.
My opinion is that if you want to look fresher and you want to look a little bit younger, it's not a facelift, it's not surgery, but if you want to actually enhance and improve what you might have had maybe 5, 10, 15 years ago, then these treatments are absolutely ideal for that.
Yes, I have had non-surgical cosmetic things done before. I've been having Botox for 5 years and I've had my lips done once.
Definitely feel more confident. I like that I'm not getting wrinkles. My lips, I enjoy them, they look good. I don't ever have any negative feedback from them. So yeah, definitely go ahead and done.
As long as Botox or dermal fillers is in safe hands, then it is safe. Unfortunately, in the business at the moment, we've got situations where people who are inexperienced, doctors or nurses, or other people that are not qualified, are getting hold of these injections, and that's when mistakes are happening. Long term, yeah, it's as long as you don't have too much or you overdo it and you're very careful on what you have done, then yeah, it can be pretty safe. I think the benefits far outweigh the risks if it's done with somebody who knows what they're doing. The job satisfaction that I get is amazing. I see clients, patients in many different situations. Some ladies might be going through divorce, some might be have some trauma in their lives, or they're just getting old and it's not nice. They want to look a little bit brighter or fresher, and also in this current the way we are today, we are looking younger, and our lifestyle is very busy, and sometimes our faces get a little bit left behind. So I think if it can give that sort of you look good, you look in the mirror and you look good, you automatically are going to feel good, and that's what this does. It's a feel good factor, done properly, of course.
Yes, I have recommended it to friends and family because it's made me feel better about myself. They've had issues and concerns about certain things. Some people have had treatments done at other places and it's not been that good, so I've recommended to the place that I go to have corrections, and it has changed their lives too.
I probably will keep on having things done. Don't think it would ever be a facelift or anything like that, but non-surgical cosmetic things, yeah, I would probably carry on having done.
1, 2, 3. How's that? Okay. Breathe it away.
As for looking natural, yeah, up to being 40-year-old, and then once I hit 40, I decided to have some Botox done, and I've been having it done for the last 5 years.
Well, I consider that every injection I make is actually a culmination of 34 years of nursing. That is working with people, being with people, watching people, listening to people. As a nurse, that is part of my skill and experience, so I bring that to each injection. I'm a registered general nurse, which is a 3-year training, and I'm also an independent nurse prescriber, so I had to go to university and do a year-long course for that.
Many of the same women have been going to Amanda for the last 5 years for treatments, as they feel comfortable with her and her work that she does and how she does it.
I did training on the treatments and was certificated for that. And then I have done lots of masterclasses, attended conference, I'm a part of forums, and I've worked for 3 consultant surgeons for 8 years, and we share information and expertise.
In the past, I have heard of, there is a risk of anaphylactic reaction and allergic reaction, not to Botox, as it, funnily enough, but to dermal fillers. I find that the dermal fillers, which are not particularly regulated and are not a prescription drug like Botox is, they do have, there can be a lot of problems with them, but again, it's all down to your practitioner, the quality of the product and who is injecting it.
So I'm trained in dealing with complications, should they arise. I'm very aware of what can arise and what can happen and what I would do in those instances, should that happen. Fortunately, that hasn't to date.
We've learned throughout this the different outcomes from having these non-cosmetic procedures done. Many women go through having these done to make changes to their appearance, as most women do not feel comfortable with their natural look. From small faults such as not having bigger lips and having a few creases in the forehead and around the eyes. It's like these women just do not want to grow old gracefully. Will women ever stop having non-cosmetic procedures?